Well, good morning. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Song Brown Primary Care Technical Assistance webinar. Before we begin, I would like to discuss a few housekeeping items. First off, the webinar will be recorded and posted on our website in approximately 7 to 10 business days. Today, the chat option will be open during our question and answer session, which will be at the end of the webinar. At that time, please feel free to place all your questions in the chat and we'll try to make sure to get to everybody's questions today. And then lastly, the slide deck is posted on our website. And if you look in the chat box right now, you can see that we have all of our links and everything, resources posted there, and we will continue to post those so that you have access to the website, the webinar slide deck, and everything else that's pertinent for today. And with that, I am thrilled to introduce our first presenter, Jonathan Nazario, Program Officer for the Song Brown Primary Care Residence Program. Jonathan.
Thank you, Chris. Okay. Hi, everybody. As you all know, my name is Jonathan. Nice to meet you all. About Song Brown, we're both going to go over these since it's on the grant guide and everybody, or on the TA guide, and everybody can view them whenever you get the opportunity to review them. A little bit about Song Brown. Song Brown provides funding to educate programs including primary care, family nurse practitioners, registered nurses, and midwifery programs, in addition to NP/PA fellows as a new addition. Next slide, please. Here is all the application important dates regarding the EAP registration, which is open, the application release date, which is July 18th, and it's already open. Early submission date, which is a very important date. Please keep that in mind. It's August 17th. And the application deadline, which is August 31st. Next slide. Before you apply, please keep these things in mind. If your program requires approval to contract from a coordinating authority, inform that authority of terms and conditions contained in the grant agreement. Applicants must agree to the terms and conditions before receiving funds. HCI will not make any changes to the terms and conditions specified in the grant agreement. The grant agreement templates can be found in our grant guide, and that can be found online. So if you want to look at it ahead of time, you can do that. Funds shall be used to expand primary care services. Funds shall not supplant existing federal, state, or local funds to provide primary care services. Next slide, please. Here are the changes for the 2023. Programs applying for both THC and existing PCR slots funding can apply for a combined total of 11 unique filled first-year slots, 5 existing slots, and 6 THC slots, not to exceed the program total number of filled first-year positions. For example, if applying for THC and existing program funding has 7 filled first-year slots, they may only apply for a combined total of 7 THC and existing slots. Next slide, please. Information to gather for your existing expansion and THC applications before you start applying. Try to get the correct organization name and address. The legal name must match what is reported to the IRS. Grant agreement and payee data record information, or the signatory information. Facility types for each primary care continuity training sites. The payer mix information for each listed primary continuity clinics, and a race ethnicity data for all current residents. Next slide, please. Also try to gather your current practice site information of all the graduates entered, the national provider identification number for all graduates, applicable required attachments such as any accreditation letters or expansion letters, and permission from the organization to apply for the grant. Next slide, please. Information to gather for new programs is similar to those of existing expansion and THC. Make sure you get the correct organization name and address as reported to the IRS. The grant agreement, payee data record information, signatory information, the facility types for each primary care continuity clinics if they are applicable to you. Payer mix information for each listed primary care continuity clinic. Next slide, please. Here's a list of all the required documents that you'll need for new programs or new programs with Match. Next slide, please. This slide shows all the available Song Brown funding categories. I won't bother reading all this information. Again, it is posted on our website under the TA guide. Please look at them whenever you get a chance. Next slide, please. Keep in mind that if you're a new program, you can only apply for new program funding. You can't apply for existing expansion or THC. You can just apply for new program funding. Next slide, please. This page contains some helpful information regarding helpful information for your reference, including the Song Brown glossary and grant guide. The grant guide includes attachments detailing evaluation criteria for both existing expansion, THC, and new with Match. So be sure to check these out. Next slide, please. At this point of the presentation, we are going to skip a tad ahead, as mostly everyone has created an e-app account already. Please remember, this TA guide is posted on our website. Keep in mind, if changes have been made with your program director, training programs, or organizations, please let us know immediately. With that said, we're going to skip ahead to slide 25. Can you please go to page? Yeah, thank you. Okay, we will now go to the initial parts of the application. Next slide, please. Thank you. Here you're going to select your training program name. If not found, click on the training program not listed. Use a magnifying glass to locate your training program name. Please keep in mind that if you have applied with us previously and are unable to locate your training program name, contact us to help you find your training program name. Please don't try to add any program name and then contact us. Please try to contact us before you add a new program name if you previously applied with us. Next slide, please. Again, if your training program name isn't in the system, please add your training program name here. Next slide, please. The program information page will also list the award categories to which you can apply. You can apply for new, existing, expansion, or THC. Next slide, please. Now we will briefly go over the new programs application. Next slide, please. To start a new program application, Phase A is mandatory to receive either type of new programs funding, new programs, or new programs with Match. The phase that you have completed determines which new programs application you are eligible to apply. Next page, please. The phase that you have completed determines which new programs application you are eligible for to apply. Next page, please. To determine if you're eligible for new programs Match, you'll need to ask yourself the following questions. The following questions will be posted onto the right-hand side. For example, are you in the process of applying for or has already received sponsoring institution accreditation, has not received any prior Song Brown funding, in process of completing or has completed phases A through C, you have not yet completed phases D through G, you are willing to match 25% of your organization's funds towards each KI's total award amount. If yes to A through C, you may apply for new programs with Match funding. Next slide, please. Here is how the new programs with Match works. If awarded $2 million, you will need to match 25% of the awarded funding using your own funds. Outside of our grant funds, this would result in your total budget being $2.5 million. Next slide, please. Now we will start the new program application process. Next slide, please. To start the new program application process, check the box New Program. After completing this page, click on Save and Next. Next page, please. The contract administration page comes next in the application. Two very important notes. Your 204 address is your remit to address. If you are at all uncertain what your address your payments should be sent to, consult with your contracting authority at your organization. Additionally, your contract organization name must match what is reported to the IRS. Incorrect information on this page may cause a delay in your grant agreement process and your payments. Next page, please. Next page is the program data page. Please select yes to the responses to the phase that you have completed. If you aren't sure on something, please let us know. Selecting yes to phases A through C makes you eligible for the $2 million with a match of 25%. Next page, please. Selecting yes to phases D through G makes you eligible for the up to $1 million in funding for new programs. Keep in mind, supporting documentation is needed for each phase answered with yes. Next page, please. Next page is the training sites page. Please note we don't want all your please note we don't want all your training sites, just your continuity training sites. When selecting an address, please include the address of the continuity training site. Next page, please. Please select the facility type that applies to the continuity training site. If your continuity training site doesn't fall under any of these facility types, select not applicable. Next page, please. Enter in your payer mix information here. We need a payer mix information for each continuity training site you enter. Please enter in your payer mix information as a whole number. Next page, please. After entering your continuity training site information, you can edit or delete that information by using the options button here on the top right-hand side. Next page, please. The executive summary and program strategies page section consists of one question and a series of strategies to select. Next page, please. The residency training section consists of a series of questions. After completing this page, click on Save and Next to proceed to the next page. Next, you will enter in how much funding you are requesting. Max funding request for new programs is $1 million. Max funding request for new programs with match is $2 million. Please remember you have to do a 25% match with new programs with match. Next page. Thank you. New programs with match will populate an additional table, budget/funding. Provide your anticipated or actual expenses related to each budget category listed. Separate your costs into the respective phases. You must put in a $0 amount into the remaining unused fields. The comment box is only utilized when you have identified an expense that falls into the other category. Please provide your patient demographics here. Please note, total percentage for each section cannot surpass 100%. Here, you will attach all the documents that are required. Files uploaded must include a prefix, such as example, for accreditation needs to have ACCR_. Save your document using the prefix indicated prior to uploading. The red buttons on the page indicates required documents based on your phase selections. Please remember the required documents correspond with the phases you selected in the program data page. Once you uploaded all your documents, the buttons will turn green, signifying that you may continue. Please take into consideration that uploading speeds may take longer than the other experiences. Here's the assurances pages to be checked before submitting your application. Please read and click Agree to submit the application. Next page. Your new program application has now been submitted. Next page, please. To view or print your application, click on the down arrow button. You have the ability to print the application, but in sections. The graduate and resident section and the training program information will be on a separate print options. Next, we will discuss to complete the existing cheat sheet and expansion applications. A lot of aspects in this application process have not changed since last year. Today, we will focus more on what has changed. Each funding category listed provides eligibility criteria. Click on each funding category you qualify for. Selecting a training program here, or if not found, click on that training program not listed. Using the magnifying glass to locate your training program name, existing expansion and TC applicants most likely have applied in the past and should have a training program name already. If you need to make changes to your training program, please contact Sound Brown staff. Thank you. Next page. The next few slides are similar to the new program contract administration page. We will briefly go over them again, just in case you missed hearing them in the previous slides. Ensure all information is accurate and that the correct signatories are listed. Please verify this information with your finance office or your contracts office to ensure this information is correct. Writing incorrect information will delay your grant agreement should you be awarded. Next page, please. Here you will provide your program data on graduates and residents. Depending on your selection, additional questions may appear. Please note the last question on this page is a scored question criteria. Please refer to your grant guide attachment A for more score information. Next. You will have the option to import your previous application data into your new application. You will need to continue to use your previous program, the training program name and organization name to utilize this feature. As mentioned before, using a magnifying glass to search for your training program name. If you have to type in your name, this will not work. This import feature may not work if you did not apply last year. If reporting training sites this year, only your previously identified continuity clinics will come over. Then you will need to add another continuity clinics site. Imported data transfers to the errors list. Then you will be required to check each individual item to clear it and move forward. Next page. Select the facility type that best applies to the continuity training site. If your continuity training site doesn't fall under any of these facility types, please mark not applicable. Please note training site locations is a scored item. Please refer to the grant guide attachment A for more scoring information. Provide the payer mix information for each continuity training site you entered. Again, you are only providing your continuity clinics. Payer mix information is required for your main primary continuity clinic. Keep in mind that the payer mix information doesn't need to total 100%. On the train site viewed, you must say yes to move forward. Please note, payer mix is a scored item. Please refer to your grant guide, attachment A, for more scoring information. After entering the continuity training site information, you can edit or delete information by using the options button here. Next page. Here you will enter in your executive summary information on this page. Next page. Depending on the funding category you choose, be prepared to provide additional information. Your annual expenses can be higher than what you are requesting. However, they can't be lower. Please fill out all of these fields. Next page, please. If applying for THC funding, you will need to fill out a budget summary. If you aren't requesting funding for a budget category listed, input 0. Next slide, please. If importing resident data, please ensure that all resident data has successfully transferred over. You can view previous year's resident data in the e-app under the application tabs. Imported data transfers to the errors list, then you'll be required to check each individual record to clear it and move forward. Add additional residents here if needed. Fill out all the okay. Fill out all the fields after completing this page. Click on the Submit button after done. Please note, resident data is a scored item. Please refer to your grant guide, attachment A, for more score information. Once completed, you can add more residents. In addition, you can edit or delete the information you inputted here. Next page. If importing graduate data, please ensure that all graduate data has successfully transferred over. You can view previous year's graduate data in the eApp under the Applications tab. Imported data transfers to the error list, just like the resident data page. You will be required to check each individual record to clear it and move forward. Here you will add your graduates if needed. Once you click Add a Graduate, a window will pop up. In addition, keep in mind that the amount of graduates inputted needs to match the amount of graduates on the program data page. Graduate practice site data should always be the most current practice site data. We want to know where they are working at today. Next page, please. Selecting yes to the question, do you know the graduate's practice site, will prompt further questions. A facility type list will populate. Select the facility type that applies to the practice site. If the practice site doesn't fall under any of these facility types, please mark not applicable. Click the Add Graduate button each time you want to add a graduate. You can also edit or delete graduate information from this page. Please note, graduate data is a scored item. Please refer to the grant guide attachment A for more information. Next page. Here are common application mistakes. Please refer these carefully. One of the major things we've been seeing this cycle is previous applicants adding a training program name and did not search for a previously used training program name first. Next page, please. You can attach documents pertaining to accreditation approval and, if applicable, expansion approval here. Next page, please. Once you upload all required documents, the buttons will turn green, signifying that you may continue. Click Save and Next to continue. Assurances pages needs to be checked before submitting the application. Next page, please. Once you click Submit, your application is done. Next page. To view the information submitted or print out your application information, click on the Options tab. You have the ability to print the application button sections again. The graduate/resident and training program information will be on separate pages. Next page. Please remember, if you know someone who is wanting to start a training program, please share this information with them about our new programs funding opportunities. That's the end of our presentation. Now I'll give you the opportunity to ask your questions by opening the chat. I'm going to now refer this back to Chris.
All right, thank you, Jonathan. As you can see, the team has worked hard to put this program together, and we're really excited to be able to offer it to you today. We're going to transition to our question and answer session, and the chat should now be open. You can go to your chat bar at the top, and please put your questions in there. We're going to answer the questions in the order they were received. We will do our best to answer all the questions you have today. All right, and we got our first question. Oh, it's already moving on me. Here we go. All right. First question is, you mentioned that you need the payer mix for the last 12 months, but then list May 2021 through May 2022 instead of 22-23. Please clarify the dates, years you would like us to report. Oh, we lost your audio, Jonathan.
That would help, right? Thank you, Chris. Yeah, we did notice that mistake, and we are trying to fix it with our IT department. So we will let you guys know what the correct dates are. We can, sorry, I just like coming in. So we can definitely involve you guys later on that and let you guys know what the correct dates should be. But thank you for that question.
All right, thank you. All right, Pam asks, our program has 6 first-year slots. In the past, we have applied for 5 existing slots and 6 THC slots. Is it correct that this year we will only be able to apply for a total of 6 slots? We won't be able to apply for 5 existing slots and 6 THC slots as we have in the past, question mark.
We understand that the THC question or how much you can apply for has changed. Regarding all your THC questions, can you please submit them to our Song Brown email box so we can address them specifically, so we can answer your question more accurately and better. Thank you.
Okay. All right, Pam, so go ahead and email that question to songbrown@hki.ca.gov, and they'll help you out to determine exactly what you are able to do. All right, the next question. On the application, for certain sections, the years that it requires for the info, past years, looks like this is the same date question. Is that correct, Jonathan?
I'm so sorry. What was your question one more time?
On the application, for certain sections, the years that it requests for the info for past years, 21, 22, can you clarify these dates? Is it the same dates are listed in other program expenditures? Is this the same date question we had for the first question?
If it's you said it's an expenditures question about listing dates.
It just says certain sections request info for past years.
Would it be possible?
Oh, then it does say the same dates are listed under the program expenditures as well.
Okay. The same dates are listed under expenditures as well. That's something that we need to look into. Again, can you please send us that question through our Song Brown email box so we can address that a little more better? And if you can send us a screenshot, that'll be preferred. Thank you.
Let's see. Paul has a question. The question concerning allowed expenses to be submitted. Do you want the total budget with the breakdown, or are there exclusions?
Can you repeat that question one more time? Sorry about that.
Question concerning allowed expenses to be submitted. Do you want the total budget with the breakdown, or are there exclusions?
For which, is it for new programs or for existing expansion in THC? So for like new programs, we want it based off of the phase, the phases that you are completing, and each phase that you're going to be doing. We want the breakdown for each phase. If it's for existing expansion or THC, for existing and THC, we want the breakdown of how much you're going to be spending for the full word amount.
Okay. And Paul, if you have further questions, go ahead and put those in the chat, and we'll get back to them. Carolina asks, have applied before, but we do not have graduates yet. We were told we could still be considered a new program this year. However, do we submit a fiscal plan and timeline?
So it's better to send us an email regarding that, because there's a lot of questions that need to be asked before we can determine your eligibility. So to correctly provide you the correct response, we need to know more about your program. So please send us an email to the Song Brown email box.
Right. Regarding questions that require free text response, we see that you asked for the executive summary. There used to be other questions that we had to respond to in previous years. Are there other questions in addition to the executive summary?
Which regarding the existing expansion in THC, there used to be other summary questions we asked, but that has changed now. We are asking the executive summary question, and then we want the program strategies in addition to that.
All right. Next question. I have been approved for a 12-12-12 program, but have 2 vacancies in my current PGY3 class. We have received Song Brown funding in the past. Would we apply as a new program or expansion?
Well, you would apply for new programs because you're already accredited, you already have residents, you already started your cohort. Regarding expansion, you would, if you had an approved expansion letter and are currently expanding. But again, it's something, if you can send us an email regarding that, because regarding expansion, there's a lot more questions we need to ask you regarding to see if you're a true expansion. So can you please send us an email to the Song Brown email box so we can determine if you're a true expansion. Thank you.
All right, Vaughn, go ahead and send an email to songbrown@hki.ca.gov, and we'll be able to help you more on that one. All right, Kendra asks, are the site types for graduates a part of the scoring process? The links provided to check often don't provide any data.
The websites we have, they do provide the geographical data, I believe, and they provide you which sites they're in. If you're having any issues, to send us an email and a snippet of what you're trying to find, and we'll do our best to try to help you regarding that.
All right. And Paul said thank you, so I think we answered his question. All right, make sure we haven't missed any. Are there any other questions out there? Give everybody a minute or so to think of other questions and reply.
And again, if you guys have any more questions and you can't think of it now, please feel free to send us an email through the Song Brown email box, and we'll do our best to try to help you with your questions.
All right, here we go. Pam asks, what process will you use to give us the correct dates for the payer mix?
I'll work with our IT department and management to see how we can do that. Most likely probably be in, we'll have to correct our EAP, and they'll probably send an email out to everybody. But again, I'll have to check with management to see how we can continue with that, or how can we do that.
And we will be using the registration list for this to send emails out as well, so we can also send information through that if need be. Next question is, did the question for grads regarding practicing primary care get removed?
Right.
Okay, sorry about that. I want to go back to the payer mix information one more time. So we are trying to fix it right now. The payer mix information that we want is for May 22nd to 23. So we want 12 months worth of data from that day. And it will be fixed and it will be reflected onto the EAP hopefully soon. And what was the current question? Sorry, Chris.
Yeah, no worries. Did the question for grads regarding practicing primary care get removed?
What's the question for primary care for graduates get removed?
Question about practicing residency.
Is it question about practicing 5 years post residency, or is it the ambulatory question?
Kendra, could we get a little more clarification on your question there? Kendra replies yes to what you said, Jonathan.
It's the primary care continuity, the ambulatory question. If it's an ambulatory question, I believe you have to have graduates that are 5-year graduates. Once you select the 5 years graduates once you have 5 years graduates, they're the only ones going to have that post residency question, the ambulatory question. And you have to scroll down when you add a graduate, when you scroll down and you add the 5th year, when you scroll down, you're going to see that question.
Hopefully that answered your question, Kendra. If not, please continue to clarify. We have reposted all of the important links in the chat, so you can see all of that as well. Any other questions today? All right, Kendra says that she'll reach out. Said import issues and dates are messed up, and the question is not showing. So
yeah, please reach out to us, and we'll do our best to try to look into that for you. Thank you.
Thank you, Kendra. All right, any other questions today? Expenditure questions ask for data from 21-22. I assume you want 22-23. I think we're still having some confusion on the dates.
For the expenditures question, you asked for do we want data for 21-22, and you're assuming that we want it for 22-23. Yeah, I believe we want your expenses for the previous year.
12 years.
Yeah, for the previous years, previous 12 years, because we want to know your expenses for those 12 months.
12 months or 12 years?
12 months. 12 months. Not 12 years. That's too much.
Yeah. Okay. So that would be 22-23 for I guess some of it would depend on how they're defining their fiscal years, but
yeah.
To clarify, you're asking for the past 12 months, correct?
Yeah, verbally that past 12 months, yes.
All right. Let's see. Should the program strategies that you mentioned be included in the executive summary? What should program strategies address?
So we actually list out what we need for program strategies. I believe it's in our grant guide. So please refer to your grant guide about the program strategies. If you have more questions regarding that, please send us an email through the Songbound mailbox. We can help you regarding that.
Can still ask for clarification on the dates. We do have a typo. That's why the system says annual year 21-22. So there is a typo in there.
So Printer, on that one, send us an email and then we'll get back to you on that just so we can research it more and then we can get back to you on that one. Thank you for your patience. I appreciate it.
All right, these are good questions. Do we
Yes.
have any more today? We still have some time in our webinar, so if you have questions, give people another 30 seconds or so here. All right, looks like we've gone through the questions that we have today. Thank you for your participation, everyone, in the Q&A session. And oh, we got one more. All right, Henry, thank you. Is there a list for the direct and indirect costs for the new PCR programs?
We don't have a list of, if you're asking, do we have a list of what costs are acceptable? We don't have that list, no.
Direct costs.
If you're asking about indirect costs are costs that are associated with managing the grant.
All right.
You're welcome.
All right. Thank you, Henry. All right. Well, thank you, everybody, for your participation today. If you have more questions, please email the team at songbrown@hchi.ca.gov. As a reminder, we will be posting the recording of this webinar on our website in approximately 7 to 10 business days. We appreciate everybody joining us today to learn more about the Song Brown Primary Care Residency Program. We're excited to be able to offer it as California's original and longest lasting health workforce development program. And we're grateful for your participation with us today. Again, this screen provides the email, and then you can see in the chat the other links and resources. Please, we encourage you to go to our website to read all of the resources, including the grant guide, and use the application portal. As a reminder, the application closes August 31st, and we really look forward to your submissions. Thank you so much for attending, and with that, we conclude today's webinar. Have a wonderful day.
Thank you, everybody. Bye.
Thank you.